Rob,
Hey.
thanks for meeting with me today for your evaluation.
Of course, thanks for having me.
You're doing relatively well. I think there's a few areas that could show some improvement on, so that you're not just an average student.
Yeah, no, I bet there's places I could learn, and I'd be looking forward to maybe being able to do whatever you think I could to work on to make myself a little bit better as a student.
Like for medication administration, you don't seem to know the pharmacology quite as well as I would like to see, and you seem pretty nervous when you're administering the meds. I think that's an area that you could work on.
Yeah, I do find that I'm a little nervous at the bedside when I have to give meds. So maybe just build. Maybe if I was feeling more confident, maybe I would have more knowledge around the drugs themselves, and I wouldn't be stumbling. So I would like to probably feel more strong in that area too.
Yeah. What do you think would help you to gain your self-confidence and skills in that area?
I'm not entirely sure. I mean, maybe if I just control my nerves a little bit better by maybe I'll walk through the steps before I go to the bedside with you. Maybe in the alcove we'll do a quick walkthrough of what each one is real fast, and then I'll just then at least I'll be confident at the bedside remembering what I need to talk about.
That's a great idea. We could walk through it first and then go to the bedside. I think that would help with your confidence level and skills.
Good. Okay.
So another area I would like to see work on would be your critical thinking skills. How do you consider yourself at this point in time?
Well, it's so task-oriented being a student nurse that I get a little overwhelmed, and I'm not really thinking about the primary diagnosis. I don't really have time to look at the chart every shift. So if I had more time to go over it at the end of the shift, or maybe if we had a break in the middle of the shift so that we could maybe do it over dinner, then I would have the time I need with the materials to have a better idea of develop critical thinking around the diagnosis.
I would like to see that earlier on, like a little more preparation before you go to clinical, and then maybe chart review, and I could help you go over the chart, pick up the important points.
That would be good. I'd like that. I'd like to be able to go over the charts with someone, because they're so big. I'm just like sometimes I don't know what tab to flip to, so it's a little overwhelming.
I think that would be very helpful.
Okay.
Another area I think you could work on is your time management. I noticed when you were caring for 2 patients that you were disorganized with your care. You spent a lot of time with one patient and then you kind of ignored the other.
Yeah, that has been a problem I think about. Sometimes I want to journal about it, but I'm a little bit, I don't want to shoot myself in the foot, but I do admit to not being able to juggle two patients right now. It's not easy for me. I'm not really sure how to approach the problem right now. So
well, I can help you with some maybe some skills checklist that you could look at, looking per hour.
Yeah,
what might help you.
I've seen some of the RNs working with little like notations, and they set up their pages according to patient rooms. So I'm gonna maybe try a list like that. That would probably help me too, especially if I have 2 patients. So
to look at your prioritization.
Yeah.
So Rob, we discussed some areas that you could show improvement in. Those areas being critical thinking, time management, and medication administration.
Right. Yep.
So we can look at those, demonstrate improvement as we've discussed, and we'll meet again in another couple of weeks for your summative evaluation.
All right. Yeah, that's great. These 3 areas are pretty clear to me, so I can plan on working on them weekly, and we'll see how I am in a few weeks.
Great.
All right.
Great. Thanks so much.
Great. Okay.
Bye-bye.
Thanks a lot.